Hi, I'm Larry Belt. I hope everyone is having a great day. Many of you have worked with me for years as you have sought solutions for your Medicare plan needs. The purpose of this video is to train you to shop for your own drug plan. Medicare is a tool that will allow you to compare all your options. So let's go to the Medicare website. This tool, the way it looks and the way it functions, has changed dramatically as of October 1st, 2019, as we're now allowed to look at 2020. Now, in order to store your information on your medications in the site, you have to create an account. I am not allowed to have access to look at your situation, so this ties my hands and increases the importance of learning it yourself. I can provide advice, obviously, and help you with a safe enrollment, but let's get started. The first thing you want to do is go to Medicare.gov. That's where we're at. You'll have two choices here. We want to pick Preview 2020 Health and Drug Plans. Okay, you're going to see another two choices, log in or create an account or continue without logging in. For those of you that have your Medicare card handy and have a long list of drugs or longer list of drugs, you're probably going to want to create an account. And this will take a little more time, but you'll get back to where we're going, where we actually do the analysis. And unfortunately, I can't create a list for you and go back and reference it during the year as things change. So as I said, it increases the importance of learning how to do this yourself. So from a teaching standpoint, I'm going to go to continue without logging in. And what we're trying to find is the most cost-effective drug plan for you, at least look at our options in terms of costs. So you immediately have 5 choices and you want to pick drug plan. We're not looking for this other stuff. I don't think if you're looking for this other stuff that this is a good tool for it. You should probably talk to somebody that can give you a look at the whole marketplace and hone in on things that are right for you rather than just a mess of information. So first thing we're going to do is put a zip code in, put your own zip code in, but just out of your own knowledge base, you might want to know that these plans are all pretty much the same for whatever state you're in, and we're in Michigan. So we're gonna enter that, and now we're gonna toggle down, and more selections we have to make. This wants to know if you're getting any extra help from the government. Basically, most people are gonna pick I don't get any help. But if you have full Medicaid, this isn't a good tool for you. Get in touch with me if you do. There's going to be other better options for you than going through the Medicare Part D drug plans. If your income is not low enough to get Medicaid, then you might go to Social Security and apply for extra help on your drug costs, particularly if your drug costs are high. So that's something you would do through Social Security. And if you're granted that, we can use this website, okay? Because you're gonna tie that into a Part D drug plan, where in this scenario you would not. Okay, we don't have Medicare savings programs in Michigan for the most part, so we won't even consider that. So most people will click that. I don't get help from any of these programs. If you wind up getting help, you can make changes later. Obviously, we want to see what our costs are, so we're going to click yes. And you want to take a look at both retail and mail order. Mail order rarely anymore gives you the best prices. They want to get you in the drugstores to buy other stuff. So the pharmacies make the best deals with the insurance companies. But let's click both so you can see that for yourself. Now we're going to start entering our medications. And the person that, it's kind of a fake person, but the person I'm going to use is on a couple of expensive formulary drugs, then 3 cheap generics. So the first one we're going to pick is Eliquis. A lot of my clients are being switched to that off a cheap generic drug. So this tool normally will start populating for you as you type. And I'll toggle down and pick Eliquis, but have your drug list in front of you with an accurate names, list of accurate names and your dosages and the drug strength. So we'll do that. Now you'll see we have the option to pick the strength. I'm going to go with the default, which is 5 milligrams and a quantity of 60 per month. Now, You can put in every 3 months if you want, but I'd recommend doing every month because it'll give you a better look at what your costs are, and um, you still have the option to buy your drugs in a 90-day supply. But this person is on some expensive meds and probably doesn't want to lay out a lot of cash in 1 month. So we're going to add to that. We'll put that on, add another. The next one is an inhaler, and it's Symbicort. We're going to add that. Add the drug, and again, we want to know what our dosage is. So we're going to pick the default rather than the one that's less strong. And you don't have any choices for packaging here. You just get that one inhaler generally every month. If you need 2 in a given month, because maybe you use more than one, you can put 2 in there and just not buy 2 the following month or whatever. So for now, we're going to go with 1. All right, now it's time to add the cheap generics, blood pressure medication, lisinopril, and we're going to add that. And obviously we want to know our dosage and our quantities, 1 a day. We'll put that in. From there, we'll go to metformin, which is an oral medication for diabetes that is commonly prescribed. And with this medication, there's 3 different forms. So you want to know what the original medication was called, what the original formulary was before it went generic. And most people have glipizide. So I'll put that in. We're going to select that dosage. We'll pick the one in the middle. And normally people take 2 a day. So we'll put 60 in. Add to my drug list. From here, we're going to add the last medication, which is a cheap generic, but I'm going to put in the brand name drug and you'll see why. And that would be Lipitor. There's Lipitor. So I get this warning, a generic is available. If I choose not to take it, add brand name instead, I'm going to be charged the full cost. So you won't be helped much by your drug plan. If you have to take the non-generic, then you do. Maybe you found the generic causes reactions or whatever. So you would pick this and then apply for an exception from the drug plan once it's issued. You're going to need a statement from the doctor saying that the non-generic didn't work for you. So we're going to add the generic for now. And 40 milligram, we'll take the default again, 1 a day, which is pretty typical. I'm on that medication. So we've got our 5 meds in there. See, now at this point, it says add edit drug or remove drug. This would be to say, oh, you know what? I stopped taking that drug. Let's take it off. You click there. This is if you want to change the dosage. And for those of you that have an account, you'll go back and use these tools to tweak. So we're done adding drugs. And next stage is really important because you want to have a look at pharmacies that can potentially offer you the best case cost scenario. I would, for that reason, I would always choose a CVS and then one other, which would obviously be the one you're using if you're not using CVS. CVS is usually a preferred pharmacy with most of the bigger drug plans. They've really doubled down on getting that Medicare drug business. In fact, they owned some of their own insurance companies, but that's being broken up. So Kroger's always a good choice here too. They do a good job of being a preferred with a lot of the companies, but I'll put in Rite Aid as well. And a lot of my clients like a national pharmacy because they travel. Okay, and you'll see down here before we click the done button that we're going to look at 2 pharmacies here and a mail order. They'll only let you put 2 in. You can't put 3 or more in. Okay, now what we're doing is we're kicking out the choices in terms of lowest premium. $13.20 is probably a lower premium than most of you have now. Doesn't mean it's the right drug plan. We also have the ability to sort by lowest drug cost and lowest yearly deductible. Now those aren't, what's really important is the bottom line, and Medicare doesn't give you this anymore. So we got to do more work. Last year they were giving us by bottom line, which included the drug costs as well as the premium. So I would suggest sorting by lowest monthly premium, okay? And scroll down to one that seems to be cheapest. You can see $2,400 a year in med costs, a lot cheaper than $7,600. Now, if we were to sort by lowest, um, let's see, drug costs, we're going to get a plan that has a very high premium, but may not be the best solution. And you're going to see why here. Okay. Now what we're getting is $105 a month. That's a lot of money for a drug plan. Most people that I work with are under 25. But the pharmacy costs, the copays are only $1,700. And you can see as we toggle down, they get higher. So let's use this as a benchmark, $1,722. Write that down. And we're going to go back to lowest monthly premium because low premiums are better than high premiums, but still we want the best bottom line solution. So again, we've seen that Humana Walmart plan, $7,600. Now, if I had chosen Walmart as a pharmacy, this would probably be lower. But for now, we're going to start toggling these. So WellCare is $2,400 with a low premium of $1,370. So if I'm doing this, I'm going to write that down. Okay. And again, we're going through and we want to be alert to this. Okay, these are significantly higher costs here. There's another one for $2,300. We could potentially use that. It's about $100 though more than this WellCare plan. WellCare is going to be a big player in this marketplace in 2020. They bought out all the Aetna drug plans, as some of you may have found out. Okay, so as we're scrolling through, we're now seeing some higher costs, some lower costs. Journey RX Value doesn't have much of a footprint in this business, and so I wouldn't recommend that one. Their premiums are reasonable, but not as low as WellCare. So let's look at one more page before we move on. All right, and you can see we're in the ballpark of that $13 a month costs that we had on the WellCare plan. So I'm going to go back to that WellCare plan. Go back to page 1. Okay, and ultimately we're going to do a little math here now for you. To compare that original Blue Cross plan with a WellCare. Now, as I said, Medicare used to do the math for you. They don't do it anymore. They don't give you your entire bottom line. So I don't know how this website's an improvement, but it's what we got to work with. Here's the math. Blue Cross plan has a yearly premium of $1,261. We noted that yearly copays of $1,768.42 for a total of just over $3,000. WellCare's premium is a fraction of that at $164.40. But their yearly copays are a bit higher at $24.47, making their bottom line $26.11 versus just over $3,000. So if cost is a consideration, then I'm going to go with WellCare and don't think that Blue Cross is easier to work with. So in that regards, we're going to probably delve into this plan more, get to know more information about that. And we do that over here, okay? So we're going to click that. Now we're just seeing some redundant information here initially. Like most plans, it has a yearly deductible. This is the maximum amount allowed by Medicare. And what that means is you're going to pay more in the first month or two as you're meeting that $435. Okay, now we want to compare Rite Aid with CVS, okay? And this is where you'd really do it in this column, what you're paying every month. And I'm going to go down and it looks like they're very similar, okay, month to month costs. All right, so we can look at either one of them. They're both, and that's just telling me they're both preferred with this one here. So from this point, I want to explain these charts. This column here is what the pharmacies pay for the what the drug plans pay for the medications from the pharmacies. It really is not your cost. But as you're meeting the deductible, essentially you're paying this. But since the deductible is less than $852.47 a month, you won't pay this in your first month. Once you've paid that deductible, now your monthly co-pays are going to be $110.17. And you can see most of that is derived from the two non-generic medications. Now, a person with higher drug costs like this person, whose drug costs are over or close to $10,000 a year, you're going to go into the coverage gap, okay? At the coverage gap, now your costs have gone up for a number of months. And we'll look at this at a month-by-month basis here in a minute. But you're paying more in that coverage gap. From that point, if your costs are high enough, you're going to fall into this level they call the catastrophic level, where your rates go down. You'd really like to be there as soon as possible, but it's not always possible by doing the math. And there are levels you have to meet for each one, but everybody's different. It's hard to understand, and I would just focus in on what you're paying per month. So we see that in January, as we're meeting the deductible, our costs are the highest, $471.35. Now, most people at this point will say to me, I want a plan without a deductible. Well, there's very few plans anymore that don't have the deductibles, and there's virtually none that are cost effective for people that are on some expensive medications that don't have the deductible. So don't focus in on a plan that doesn't have a deductible. We're trying to figure your bottom line here. Now, so January, it's the highest, and in these levels here, we are at the normal copays. We've met the deductible. These are our normal copays. But in the fifth month, we're starting to go in that donut hole, and our costs are creeping up. And unfortunately, we have to spend 6 months in the donut hole, which is also called a coverage gap. That's the technical name, where the costs are again higher. And in December, we dropped down only for 1 month, unfortunately, to the catastrophic level where the costs really drop. Now, let's go down here, scroll down. This is information we've already seen. We've already explained that a bit, but I want to show you where you can go back in and tweak your medications. This chart tells you what tier you're in. And again, tiers are important, but what really you're focusing in on is what you got to pay. And we're trying to improve on that. Now, this tool here allows us to remove some drugs, okay? So we'll click there. Your situation may change by next year. You may have gotten off a couple of these drugs, and people tell me all the time that, yeah, I'm getting my weight down. My doctor's taking me off this stuff. So let's pretend that our client here is going to remove a couple of the expensive drugs, because I want to show you how drug plans work for those of you that are on a lot of cheap generics. So, I clicked the wrong button. I got to come over here and click remove. So we'll click remove. This is a new website to me as well, so a little bit of a learning curve. Now we're going to remove the Eliquis. And Eliquis is an anti-clotting drug that a lot of people are being moved to and getting sticker shock. Their doctor wants them on this rather than a cheaper generic like warfarin. So we're going to remove that, okay? So even though we subtracted, we still have to click done adding drugs. And I'm gonna stay with the same pharmacies, but we can change it here at this point too. Okay, now we're gonna see, now let's look for lowest drug costs, and it's gonna match up with a plan with a low premium. Okay, this company here, WellCare, has 0. You're getting all your meds for free because they're cheap generics, $21.90 a month. Journey RX free, $26 a month. WellCare, an even lower premium, $16.80 a month. And now we're starting to see some of the more expensive premiums. But So this person is obviously going to want that cheaper premium. And I find that these companies that with the cheaper premiums the last couple of years, WellCare, Envision, Aetna, who is sold out to WellCare, these lower premium plans were working really well for people on expensive medications as well. As you can see, for the person that was on those two most expensive medications. Now at this point, you're going to want to go through and play with this. So just to get to know it better, and you're going to make a decision about what you want. When you're ready to enroll or change, be happy to help you. I think it's better than going through any other venue because working with an agent gives you an advocate if you have a problem. You can also ask questions and get timely information if it's somebody good. If you want to contact me, I'm going to let this run for a while. Here's my contact info, and you can visit my website. The video will be up there if that's not where you've already gotten it from. But that's my email address and phone number, and you can text too. A lot of people are starting to text. So from that point, I think it's on you a little bit to get on here and practice, but I hope it's been helpful. Obviously, you want to start using it and play with it. Maybe you can start helping your friends. For existing clients, new clients, I can offer advice and help you with a safe enrollment. And, I can act as an advocate if you have those rare problems that come up and do a secure enrollment. I'm coming to an end here, but again, I'll let this contact info run a little more, but have a great day and don't panic as long as we're not into December trying to make a change. But it's never too late. Have a great day. Bye-bye.